Okay, I'm going to take off right where we left off here. So we're still in PowerPoint number 8. I'm going to start with the antepartum record. This here, keep in mind, starts in the physician office, which of course everybody knows physician office is going to be outpatient. Okay, and again, this is anything at the start of before they deliver, labor and delivery. So this is the health history of the mother, family and social history, pregnancy risk factors, and care during the pregnancy, including any tests performed, what medications, and anything in that order. Okay, so then after the antepartum, we start with labor and delivery. So with labor and delivery, we record the progress of the mother from the time she gets admitted through the time of delivery. Information includes time of onset of contractions, how severe were the contractions, what did they have an epidural, or did they have something just local, medications administered. And then you still want to always record the patient and the baby, the fetal vital signs, and how progression of labor is going. Okay, then we get into the APGAR scores of the baby. So let's go through that. Postpartum record. This information concerning the mother's condition, okay, again, keep in mind, postpartum. This is after delivery, and it's up to 6 weeks. So postpartum is 6 weeks after delivery. Birth history. It documents a summary of the pregnancy, labor and delivery, and the newborn's condition at birth. Again, keep in mind, this is the neonatal. This is what is on the baby. So newborn identification. Immediately following birth, there's footprints, fingerprints of the newborn are created. They do matching wristbands within 12 hours of birth, but keep in mind, usually anymore, this has to be within 12 hours, but hospitals really put those on automatically as soon as that baby's born. That's one of the first things that, the mother and the baby's wristbands match up. So again, the physical examination for a newborn. The newborn, again, they have to assess the newborn's condition immediately after birth, the time and the date of birth, their vital signs, their birth weight and length. Progress notes. These, again, are gathered by the nurse in the nursery. This is vital signs again. Skin color, intake and output, their weight, their medications, and any treatments and observations. Okay, so this is the APGAR scores, okay, that I talked about a little bit before. And what they are, they take these right away. And sometimes they'll wait 5 minutes, 10 minutes, and they take them again. So basically what you want is after 5-10 minutes, when they take these again, the score needs to be higher, because they look at the appearance of the baby, the skin, the color, are they starting to pink up? And they look at it again later. They look at the pulse, is the pulse getting stronger? If it is, that's great. Of course, the score is going to go higher. And the grimace, how irritable is the baby? Okay, and activity, muscle tone. After so long, again, hopefully the muscle tone gets better. And respirations, how is the baby breathing? So again, these are evaluated twice after the baby's born. Charts. We locate the mother's information off the chart. This includes any antepartum, labor and delivery, and postpartum. You locate all the newborn information off the chart too. Okay, we have the history, the APGAR scores, etc. Okay, so now let's go to the autopsy report. What this is an examination of the body after death. Again, the first thing they do is the macroscopic, which again, this is gross with the naked eye. Then they do the microscopic exam, which they look at vital organs. If somebody had a heart attack, they're going to look at the heart, of course, and all the arteries going to the heart. Tissue specimens to assist in determining the cause of death. The character extent of changes, again, that was possibly produced by disease. An autopsy is completed for suspicious deaths and in the event of an untimely death. So again, if somebody under, it's kind of uncommon for somebody to have a heart attack, in their 40s, early 40s, 30s, anything like that. If this does happen, again, that would be an untimely death. Suspicious death, this could be anything from, a hanging or, anything that they need to investigate more. The elements of an autopsy report. This is a summary of the patient's clinical history, diseases, surgical history and treatment, detailed results of the findings, what were the factors that led to death, and the clinical pathologic correlation. And then, of course, the pathologist has to sign too on an autopsy. Hospital outpatient record. Again, outpatient can mean so many different things. Outpatient care is defined as medical or surgical care that does not include an overnight stay in the hospital. So somebody, an outpatient, cannot be in the hospital longer than 23 hours, 59 minutes, and 59 seconds. This includes diagnostic, therapeutic, and ER services. Okay, so outpatient, this is observation, this is ER, so anything. Also, outpatient is a physician office visit, okay? Those are all outpatient examples. Okay, and then outpatient records. This includes patient registration form, similar to the inpatient face sheet, depending on the complexity of the outpatient services provided, and there could be additional reports. You have short stay record, which allows providers to record the history, physical exam on a one-sided form. So what is an outpatient visit? Is the visit of a patient on one calendar day to one or more hospital departments for the purpose of receiving outpatient health care. So this is considered an encounter. An encounter is a professional contact between a patient and the provider can be anyone delivering services to the patient. So that could be the radiologist, again, who's ever delivering those services. An encounter is not the same as ancillary service visit or occasion of service. So encounter, again, wouldn't be, again, like lab. Okay, so keep in mind that. Lab's ancillary. Physician office records. This should contain the patient registration information, a problem list, medication record, and progress notes. Okay, so physician office records, keep in mind, is everything that happens in the office. Okay, so they come in and gets the patient's information, their insurance, what's wrong with the patient every time that they've come into the doctor's office, medication, the different medications the patient's on, and progress notes, what happened at that visit that day. This is very, very, you need this documentation because that's how coders and other people look at this documentation to decide what level of service to charge that patient for that day. And when we're talking about charging, that's when we get into the super bill. This is used in physician offices. It captures the charges generated during an office visit. It consists of a single paper, common services provided in the office. So with this super bill, again, you need the documentation. That way you know what to use for a diagnosis code, procedure code, anything on that level. Okay, that wraps up PowerPoint number 8. If anybody has any questions or concerns, shoot me an email. I would love to hear from you.